Today we are going to discuss the drugs used in urinary tract infection and sexually transmitted diseases, that is STDs. Now, what is mean by urinary tract infection? What are various types of urinary tract infection? We'll see. Urinary tract infection is an infection that affects parts of the urinary tract. What is urinary tract infection? It's an infection that affects parts of the urinary tract. When it affects the lower urinary tract, it is known as bladder infection, or we call it as a cystitis. When we call it as a cystitis, when it affects the lower urinary tract, it is known as a bladder infection, and the bladder infection is called as cystitis. When it affects the upper urinary tract, it is known as kidney function or pyelonephritis. Upper urinary tract infections, we call it as a pyelonephritis, and lower urinary tract infection, cystitis, urethritis, which is often sexually transmitted, and prostatitis. So if there is a prostatitis, urethritis or cystitis, these are the lower urinary tract infections, and pyelonephritis is the upper urinary tract infection. Now, what are the symptoms of urinary tract infection, UTI? There is a difficulty in the urination, dysuria, increased frequency of urination, blood in the urine or hematuria, fever with chills and rigors, If the kidney is involved, or if there is a pyelonephritis, then there will be a vomiting and nausea, and it is associated with the flank pain. So these are the symptoms of urinary tract infection: dysuria, difficulty in urination, increased frequency of urination, blood in urine or hematuria, fever with chills and rigors, nausea, vomiting, and flank pain when there is a pyelonephritis. Now, what are the various causative agents? Positive urine culture when there is more than 1 lakh CFU per ml, colony forming units per ml. When we say positive urine culture, when there is more than 1 lakh colony forming units per ml. Most common pathogen for UTI is the E. coli, or we can say most common pathogen for cystitis, prostatitis, pyelonephritis is the E. coli. Staphylococcus saprophyticus, Proteus, Pseudomonas, and Klebsiella and Enterococci. Proteus mirabilis, Klebsiella, Enterococcus. Most common pathogens for urethritis, which is often sexually transmitted, Chlamydia, Trachomatis, and Neisseria gonorrhea. These are the causative agents. Now, the drugs used for this UTI is the Cotrimoxazole. Cotrimoxazole is a fixed dose combination of sulfamethoxazole and trimethoprim. So it is used in acute uncomplicated urinary tract infection. Where we use? In acute uncomplicated urinary tract infection. And this acute uncomplicated urinary tract infection respond to the single dose therapy with 4 tablets of cotrimoxazole in acute cystitis. What we do in acute cystitis, or which is uncomplicated? Single dose therapy with 4 tablets of cotrimoxazole is given. This cotrimoxazole is preferred in chronic and recurrent cases, and hence cotrimoxazole is also used for prophylaxis of recurrent cystitis. It is also used for prophylactic purpose and is also used for therapeutic purpose. Most of the time it is used as an empirical therapy because majority of the pathogens covered, including Chlamydia, Trachomatis. Means it is used as an empirical therapy when the causative agent is not known. When we do not know the causative agent, we give this cotrimoxazole as an empirical therapy. Not used to treat urinary tract infection in pregnancy because it is contraindicated, it is a teratogenic, so it is not used in pregnancy. Quinolones. Whenever there is a urinary tract infection, the most preferred drug is Norflox. Mostly first generation fluoroquinolones, especially Norflox, Cipro, are highly effective. Most potent against gram-negative bacilli like Pseudomonas, Proteus, E. coli. Nalgesic acid can be used also because it will get concentrated in the urine. So nalgesic acid also can be used. The most preferred drug is the norfloxacin 400 mg BD for 7 days. It is preferred in complicated cases also. Means complicated cases with prostatitis with indwelling catheters. If there is a catheterization, if there is a prostatitis and urinary tract infection, you can prefer quinolones. It is effective against bacteria which are resistant to cotrimoxazole and ampicillin, and quinolones are also not used in pregnancy. Ampicillin and amoxicillin. Because of high failure and relapse rate, there is a high failure rate and relapse rate seen with the empirical therapy of ampicillin and amoxicillin. Many E. coli strains are now ampicillin resistance. Now most of the E. coli strains are ampicillin resistance. They are not sensitive. Amoxicillin is combined with clavulanic acid is more frequently employed. Amoxiclav is more preferable is more preferred nowadays. But parenteral coamoxiclav along with Gentamicin for initial treatment of acute pyelonephritis. You can give amoxiclav with Gentamicin for initial treatment of acute pyelonephritis. Piperacillin and ticaracillin. This piperacillin and ticaracillin is used only in serious pseudomonal infection. Means they have effect. These are the anti-pseudomonal penicillins. So piperacillin or ticaracillin, they are used only in serious pseudomonal infection. So these are the anti-pseudomonal penicillins. So they are used in serious pseudomonal infection in patients with indwelling catheters and chronic urinary obstruction like BPH or because of calculi. Means complicated infections when there is a catheterization or chronic obstruction due to renal calculi or benign prostatic hypertrophy. Cephalosporins are also used, especially in nosocomial, Klebsiella and Proteus. Hospital-acquired infections is mostly used in hospital-acquired or nosocomial, Klebsiella or Proteus. It is employed only on the basis of culture sensitivity report. Means when the culture sensitivity report is there, then only you can give the cephalosporins. Empirical use for community acquired urinary tract infection, but if it is a community acquired urinary tract infection, then you can use empirically. Cephalexin and cefpodoxime are given orally for acute urinary tract infection. It is given for acute urinary tract infection. Which drugs? Cephalexin and cefpodoxime. Cefpodoxime and cephalexin. Now gentamicin. Gentamicin, it is very effective against most urinary pathogen including Pseudomonas. The gentamicin is effective against Pseudomonas. But because of narrow margin of safety and parenteral route, these are the limitations for gentamicin. Gentamicin is an aminoglycoside. So they are not preferred orally because of it is highly ionized or highly polar drug. Narrow margin of safety, and newer aminoglycosides are employed in nosocomial infections, and it is avoided in renal impairment. Because why it is avoided in renal impairment? Because it will get concentrated in the renal cortex. It may damage the renal tubules. Nitrofurantoin and methenamine, these are the urinary antiseptics. Urinary antiseptics, nitrofurantoin. It attains antibacterial concentration only in urine. That's why it is called as urinary antiseptic. Primarily it's a bacteriostatic, but it's suicidal at a higher concentration and in acidic urine. Primarily, nitrofurantoin is a bacteriostatic, but it acts as a bactericidal at a higher concentration and in the acidic urine. It is effective against many gram-negative bacteria like E. coli. It antagonizes the bactericidal action of nalgesic acid, so it is not given along with nalgesic acid because it antagonizes the bactericidal action of nalgesic acid. Susceptible bacteria, mechanism of action, enzymatically reduce nitrofurantoin to generate reactive intermediates which damages the DNA. How it acts? It particularly damages the DNA. Probenecid inhibits its tubular secretion and reduces the concentration attained in urine, so may interfere with its urinary antiseptic action. So it is not given along with probenecid. Why? Because it inhibits tubular secretion and reduces the concentration attained in the urine, so it may interfere with the urinary antiseptic action. Adverse effects like gastrointestinal intolerance or GI disturbances. There is a chance of peripheral neuritis, other neurological effects, hemolytic anemia in G6PD individuals or G6PD deficiency individuals. The only indication for nitrofurantoin is uncomplicated lower urinary tract infection not associated with prostatitis. If there is no indwelling catheter, no prostatitis, it is uncomplicated lower urinary tract infection, then you can go for nitrofurantoin. Then methenamine or hexamine. This hexamethylene tetraamine, which is inactive as such, which slowly decomposes in the acidic urine to release the formaldehyde, and this methenamine releases the formaldehyde, which inhibits all bacteria. Formaldehyde is the main factor which inhibits all bacteria. Mandelic acid, given as a methenamine mandylate, is excreted in urine. It lowers the urinary pH and promotes decomposition of methenamine. So its use is restricted to the chronic resistant type of urinary tract infection not involving the kidney substance. Adverse effects like gastritis, chemical cystitis and hematuria. Now urinary analgesic. Phenazopyridine, it's a purely urinary analgesic. It's a orange dye which has analgesic action in urinary tract. It's a purely analgesic action. There is a symptomatic relief in the burning sensation, dysuria or urgency due to cystitis. So it gives a symptomatic relief in burning sensation. Dysuria means difficulty in urine and urgency due to cystitis. It does not have any antibacterial property. Nausea and epigastric pain are the adverse effects. So antimicrobial regimens for acute urinary tract infection. All are given for 3 to 5 days. Means you can give norfloxacin 400 mg 12 hourly or BD for 3 to 5 days. Ciprofloxacin 200 to 500 mg BD. Aflox 200 to 400 mg BD. Cotrimoxazole 960 mg BD. It's a combination of sulfamethoxazole 800 mg and 160 trimethoprim. Because that's why the cotrimoxazole is 960 mg BD. Cephalexin is given 250 to 500 mg 4 times in a day. Cephalosporins proxetil 200 mg BD. Amoxiclav, that is amoxicillin 500 mg and clavulinic acid 125 mg 3 times a day. Nitrofurantoin 50 mg 8 hourly or 100 mg 12 hourly for 5 to 7 days. So this is the antimicrobial regimen for acute UTI which is given for 3 to 5 days or 5 to 7 days. Favorable urinary pH for antimicrobial action means if the urinary pH or urine pH is acidic, then nitrofurantoin, methenamine, tetracycline and cloxacillin, these are the drugs are used. If the urine is alkaline, then cotrimoxazole, aminoglycosides, because they are more effective at alkaline pH, gentamicin, cephalosporin, fluoroquinolones are used. pH immaterial, nothing to do with pH, chloramphenicol and ampicillin. So favorable urinary pH for antimicrobial action. Prophylaxis for urinary tract infection. This may be given when there is a lot of prophylaxis. Women of childbearing age, those who are having recurrent cystitis. When there is a catheterization or instrumentation that leads to the trauma to the lining of urinary tract. So bacteremia frequently occurs and injured lining is especially susceptible. So when there is a catheterization or instrumentation or recurrent cystitis, indwelling catheters, so these are the conditions in which prophylaxis for urinary tract infection is given. Now, inoperable prostate enlargement. Inoperable prostate enlargement or other chronic obstruction causes urinary stasis. So, most commonly or frequently used drugs for prophylaxis of lower UTI: Cotrimoxazole 480 mg. Cotrimoxazole 480 mg means 400 mg of sulfamethoxazole and 80 mg of trimethoprim. Nitrofurantoin 100 mg. Norflox 400, Cephalosporins 250. All drugs are given once daily at bedtime. Now we will see what are sexually transmitted diseases. Sexually transmitted diseases are infections that are spread from person to person through intimate sexual contact. What is STDs or sexually transmitted diseases? These are the infections which are spread from person to person through intimate sexual contact. Whenever there is intimate sexual contact, it may get spread from person to person. And this 1 in 4 teenagers has an STD, sexually transmitted disease. 1 in 4 teenagers means incidence rate is very much high. Prevalence rate is also very much high. STDs are diseases and infections which are capable of being spread from person to person through the sexual intercourse or orogenital contact or in non-sexual ways also. It is also spread through intravenous drug administration, or it may get transmitted congenitally, or we can say transplacentally. So common STDs or common sexually transmitted infections like Chlamydia, Gonorrhea, genital herpes because of herpes simplex virus 2, genital warts because of human papilloma virus, hepatitis B, HIV and AIDS, pubic lice, syphilis, trichomoniasis. These are the common sexually transmitted infections. Now, what is gonorrhea? Gonorrhea is a sexually transmitted infection which is caused by bacteria Neisseria gonorrhea or gonococci. The bacteria mainly found where it is found in the discharge from the penis or in the vaginal fluid. Discharge from the penis and in the vaginal fluid. Gonorrhea is easily passed between people through unprotected, the most importantly unprotected vaginal sex, oral sex or anal sex. But unprotected word is important. You have to use the protection to prevent the spread of gonorrhea. Non-penicillinase gonorrhea producing treated with amoxicillin and ampicillin along with probenecid. Non-penicillinase producing treated with amoxicillin along with probenecid or ampicillin along with probenecid. Penicillinase producing treated with azithromycin means if there is a penicillinase producing, then you can treat with the azithromycin. Single dose of 1 gram or ceftriaxone or cefuroxime. In most of the sexually transmitted infection, single dose of azithromycin 1 gram is enough to treat most of the sexually transmitted infections. Now syphilis. Syphilis is caused by Trichomoniasis pallidum. Syphilis is spread through unprotected vaginal, anal or oral sex. Syphilis causes sores on your genitals called chancroid. Syphilis causes sores on your genitals, it is called chancroid. The sores are usually painless, but they can easily spread the infection to the other people. They are painless. Sores are painless, but they can easily spread the infection. You get syphilis from contact with the sores. Early and late syphilis. Early means primary, secondary and latent. Late means more than 1 year treated with benzathine and procaine penicillin. So how will you treat this syphilis? Doxycycline, erythromycin and ceftriaxone are the alternatives, but mostly benzathine and procaine penicillins are preferred. Chlamydia trachomatis, it is non-specific urethritis. Chlamydia trachomatis causes non-specific urethritis and lymphogranuloma venerum. It is treated with a single dose of azithromycin 1 gram. To treat non-specific urethritis and lymphogranuloma venerum, erythromycin is an alternative. You can also use doxycycline. Chlamydia, Trichomoniasis. So as I told you, in most of the STDs, single dose of azithromycin is enough. Granuloma inguinale or donovanosis. Granuloma inguinale is a genital ulcerative disease caused by intracellular gram-negative bacteria, that is Klebsiella and Granulomatis. Clinically, the disease is commonly characterized as painless, slowly progressive ulcerative lesions on the genitals without regional lymphadenopathy, subcutaneous granulomas. The lesions are highly vascular, that means beefy red appearance, and it may bleed. So how will you treat this granuloma inguinale? Again, doxycycline or azithromycin 1 gram for 1 month. Here, not a single dose. Here you can give azithromycin 1 gram for at least 1 month. Erythromycin is an alternative. Chancroid. Chancroid is a bacterial sexual transmitted disease caused by Haemophilus ducreyi. It is characterized by genital ulcers, but these genital ulcers are painful, necrotizing, and that may accompanied by inguinal lymphadenopathy. It is highly contagious but curable. Azithromycin 1 gram single dose or ceftriaxone 250 mg intramuscular single dose or erythromycin. So these are the options to treat chancroid. Trichomonas vaginitis. Trichomonas vaginitis or Trichomoniasis is a parasitic protozoa that infect the urogenital tract, both women's and men's worldwide. Trichomoniasis is the most common STD. It's our most common sexual transmitted infection with annual incidence of more than 170 million cases worldwide. So how will you treat if it is a parasitic infection, parasitic protozoa? Metronidazole 2 gram single dose, tinidazole, or you have to treat the male partner also if it is recurrent. Genital herpes simplex. The herpes simplex virus are of two types, herpes simplex virus 1 and herpes simplex virus 2. Herpes simplex virus 1 is mainly transmitted by oral to oral contact. It will cause oral herpes or herpes labialis, which can cause cold sores, but it may also cause genital herpes also. Herpes simplex virus 2 is sexually transmitted infection that cause genital herpes. Mostly oral and genital herpes infections are asymptomatic. Though they are asymptomatic, they can spread the infection. Symptoms of herpes include painful blisters or ulcers at the site of infection. Herpes infections are most contagious when symptoms are present, but can still transmit it to the others in the absence of symptom. Infection with the herpes simplex virus 2 increases the risk of acquiring and transmitting HIV infection. So how will you treat this genital herpes simplex infection? By giving tablet acyclovir, or you can use the acyclovir ointments. Tablet acyclovir is given 4 times in a day. Tablet acyclovir is given 4 times in a day in genital herpes.